Our 8:40 is a COVID-19 update with Kathy and Jamie are here again, and Kathy and Jamie, I kind of asked our board members individually this morning if they think it was necessary for you to come forward anymore after today, and I think we can, we're hopeful that today can be your last COVID report to us on a bi-weekly basis now, and hopefully, unless you find it important, have something important to come forward, I think today we can probably have this be your last one. I know you have better things to do, so.
But I think the conversation the point I had, Mr. Chair, is that you've done such a great job with making sure the public is informed through social media, through news outlets, that you really created an avenue to get the information out. And I agree with you. I think that if something large comes up, you can always have the opportunity to come forward. But for now, we'll give you that morning off.
All right.
Thank you, Mr. Chair and Commissioners. We handed out the update that shows the cumulative cases, not a significant change at all. From the end of June, the deaths in Clay County are at 92, so no changes in the deaths, just a few in Minnesota across the state. And the numbers of out of isolation are the cumulative deaths and those that then finish their isolation. And so we only have 11 active cases. We had 15 at the end of June. So we're really, the numbers are remaining great, and that's good. The number of people getting immunized are providing that immunity. So it's good that we haven't had any ramp up. Of course, they're looking at the variant strains that are occurring in different parts of the country as well. But right now it's looking good for us. The cases per week are showing just the graph down below, as we always look at when they've peaked and how they've been going down. Age cases on the next page, so the number of active cases by age range, and then the cumulative cases. So you're seeing just, again, the small number of cases are really not showing a large number. The highest is 15 to 19, but it's not significantly more than kind of across the spectrum. Cumulatively, it's been the 20 to the 24-year-olds. It's been at the highest cumulatively for number of cases. And then I think Jamie will give the vaccine administration update.
Good morning. As Kathy mentioned, the cases are down, but the virus continues to be in the community, and we do get updates weekly from the Minnesota Department of Health on what the lab is looking at in terms of variants. But they're seeing good control with the vaccine, and the number of individuals who are vaccinated continue to grow. The data shows in Clay County, people with at least one vaccine dose at 56% right now, and then people with a completed vaccine series at 53%. And then we've got the breakdown there for the age groups and opportunities for growth in that. And just to let you know what's going on, there are lots of opportunities in the community. Our Sanford, Essentia, and our local pharmacies continue to provide opportunities for COVID vaccine, and Clay County Public Health continues to make that a priority. So we've been doing one clinic a week. Our response is low because of opportunities available and the number of people that have been vaccinated. This week we have a clinic on Wednesday, and that is from 10 to 2 p.m. And we are providing Pfizer vaccine available for anyone 12 and older, and we have the Johnson & Johnson vaccine for anyone 18 years of age and older. We advertised last week, and the media was able to post that for us, and we are encouraging people to register, but also accepting walk-ins for those clinics as well to make it as easy as possible for people. Our staff continue to work with the universities and also the K-12 schools to provide vaccine. We've been in the Moorhead School District. We have 2 dates scheduled for next week at the DGF school and planning for the universities as students come back. So still busy with vaccine, and they're a priority for public health.
Commissioner Mojo.
Thank you. In terms of the testing site, I'm looking back at the last 4 weeks, and you really have only had maybe one, no more than one each week of a positive case there. What are you hearing from the state in terms of reallocating of resources?
Minnesota Department of Health put out new guidance last week, basically still saying that priority is testing. So there was some guidance that really talked about those that are vaccinated and those that are not vaccinated. So for those that have been vaccinated, they're saying if you have symptoms, you should get tested immediately. If you've been exposed and you've been vaccinated, you don't need to get tested unless you develop symptoms. And then for international travel, even if you've been vaccinated, that you get tested prior to or after. So they're not telling us that they won't continue to support our site.
Yeah, and actually, Commissioner Mojo, they are going to continue our site. We were I think they only closed down 2 sites across the state, so I believe we have a few, and Moorhead is one of them. They'll continue. They haven't given us an end date, but we're going to continue on through the summer. So that's good news, that we still have the opportunity to provide the saliva testing site.
And then I do have a follow-up question, transitioning a little bit, but still on the vaccination route. We had planned for vaccine storage early on, and I know that it wasn't really an issue for us in the first few months of this year, just because as soon as we got it, it was going out. But now that I'm seeing you're doing a great job of administering, but I'm sure that you have maybe a little bit of a surplus of the vaccine versus who's coming forward. Is that storage that you have continuing to be adequate?
Yes, Commissioner Mojo, we had purchased an extra freezer with the CARES funding, and also a refrigerator, an extra refrigerator. So those have proved to be adequate. A lot of our vaccine was stored at our regional site, so we were able to just request vaccine as needed. So they were able to store in the ultra-cold storage at the regional site. So it helped that we weren't overloaded with our storage locally. So we're able to get that vaccine right away. It's just out of Otter Tail. So, but those 2 with the extra fridge and their extra refrigeration has proven to be adequate for the vaccine we need.
Okay, so as we move forward, we've been clear to make sure and address any needs that arise because of COVID, make sure and if there is a gap of something that you're missing, make sure and communicate that to Steve, and we'll work with the American Rescue Funds to distribute if needed.
Thank you.
Thank you.
I do want to mention that the governor did put out his press release that said 70%, they met 70% of people vaccinated across the state by July 4th. So they don't have the updated data. That's why we don't have that 70% number on our data. They have not updated that yet. I suspect that will happen this week. But he was pleased to say that Minnesota met that 70% percentage of vaccines. So that was a good thing.
All right. Anything else?
That's it.
Thank you.
Thank you.
Thank you.